Okay, let's dive into this. Welcome to today's Explainer, where we're going to explore a really fascinating and incredibly relevant medical topic, the comprehensive guide to goiter management and treatment. If you've ever felt a strange lump in your throat, or maybe you know someone who's dealt with thyroid issues, you know firsthand just how unsettling it can be. Goiters, which are basically abnormal enlargements of the thyroid gland, are actually one of the most common thyroid disorders worldwide. But there's a lot of misinformation out there. So today, we're going to break down exactly what a goiter is, why it happens, and how it's managed, getting the facts straight from the source. We're going to logically peel back the onion on this one. We'll start with the butterfly in your neck, then move on to causes and types of goiters, symptoms and emergency red flags, diagnosing the enlarged thyroid, treatment and post-surgery care, and finally, comparing goiters, nodules, and cancer. Section 1. The butterfly in your neck. Understanding your thyroid. Before we can even talk about what goes wrong when a goiter forms, we kind of have to understand the normal machinery, right? Located right in the front of your neck, just below your Adam's apple, is this small, butterfly-shaped gland that acts as your body's master metabolic engine. I want you to imagine your body as a complex machine. Well, these two hormones it produces, T3 and T4, are the exact signals that tell the machine how fast or slow to run. These hormones are absolutely crucial. They regulate the whole shebang, the speed of your metabolism, your heart rate, body temperature, energy production, muscle function, and even brain development. Without the thyroid firing off these exact signals, our systems would literally lose their rhythm. Now, what's really interesting about this setup is how perfectly this system regulates itself. It uses a three-step feedback loop called the hypothalamic pituitary thyroid axis. Think of this exactly like the thermostat in your house. Step 1. Your hypothalamus senses the temperature and sends out a signal called TRH. Step 2, your pituitary gland acts as the control panel, receives that signal and produces TSH, or thyroid stimulating hormone. And then step 3, your thyroid gland acts as the furnace. It takes in that TSH and pumps out the actual heat, which are your T3 and T4 hormones. It's an incredibly beautiful, balanced loop. Section 2, causes and types of goiters, when the engine expands. So what happens when that perfectly balanced system gets thrown off? Well, you get a goiter, an abnormal enlargement of the thyroid gland. But here's the most reassuring thing you're going to hear today. This enlargement can happen totally regardless of your actual hormone levels. You could have a goiter with perfectly normal hormone levels, that's called euthyroid. Or you could have low levels, which is hypothyroidism, or even high levels, hyperthyroidism. The main takeaway here is that just because the gland has grown larger, it doesn't mean your hormones are wildly out of control, and it absolutely does not automatically mean cancer. Goiters actually come in a few distinct forms, and we can separate them by their physical structure and by how they affect your hormones. Structurally speaking, you might have a diffuse goiter, where the entire gland gets evenly enlarged. Or it could be a nodular goiter, meaning there's just one distinct lump. Got several lumps? That's a multinodular goiter. Then, looking at the hormone side of things, a toxic goiter is an overactive one, pumping out excessive hormones. A non-toxic goiter, on the other hand, is just an enlarged structure. Zero extra hormone production happening there. So why does this expansion happen in the first place? Well, the crucial point is that, globally speaking, iodine deficiency is by far the leading cause. Your thyroid literally needs iodine to build its hormones. But in places where people get plenty of iodine in their diets, the leading culprits shift to autoimmune diseases. You've got Hashimoto's thyroiditis causing autoimmune hypothyroidism and Graves' disease driving autoimmune hyperthyroidism. Other triggers can be things like pregnancy, certain medications like lithium, your genetics, or simply just being female and over the age of 40. Section 3. Symptoms and emergency red flags. Listening to your body. Let's talk about what this actually feels like for the patient. How do you even know if you have a goiter? Honestly, many small ones cause absolutely zero symptoms. You wouldn't even know it's there. But the larger ones, they can cause visible neck swelling, a lump you can actually feel, a cough, or this really tight, uncomfortable pressure sensation in your throat. And if the goiter is messing with your hormone levels, the symptoms go way beyond your neck. This brilliantly illustrates two extreme ends of the spectrum. If it's tied to hypothyroidism, your whole body gets sluggish. We're talking crushing fatigue, weight gain, freezing when everyone else is warm, and dry skin. On the flip side, if it's hyperthyroidism, your engine is revving way too high. You might see sudden weight loss, heart palpitations, tremors, heavy sweating, and severe anxiety. Same physical lump, completely opposite hormonal symptoms. Now, while it's true that most goiters are really slow-growing and highly manageable, there are some very strict exceptions. We have to ask,
When does a goiter cross the line into a true medical emergency?
If you or someone you love experiences any of these red flags, immediate medical intervention is totally non-negotiable. We're looking at severe difficulty breathing, especially if the swelling is literally compressing the airway, any rapid, sudden enlargement of the neck, an inability to swallow, even your own saliva, sudden voice changes, or the onset of what's called a thyroid storm or myxedema coma, which are extreme, life-threatening hormonal shifts. Make no mistake, these are urgent warning signs that simply cannot wait.
Section 4. Diagnosing the enlarged thyroid, the investigation.
So, assuming we aren't in a crisis scenario, how do doctors actually figure out what's going on in there? Well, they kind of act like detectives, and it's fascinating how this builds. Step 1 is super straightforward. Just a medical history and a physical exam to check the size, symmetry, and how your thyroid moves when you swallow. Step 2 brings in the blood tests, measuring that TSH, T3, and T4 we talked about, plus antibodies. If they need a closer look, Step 3 is a thyroid ultrasound to visualize any nodules and check blood flow. And finally, if anything looks suspicious, Step 4 involves an FNA, a fine needle aspiration biopsy, to test the actual cells, or they might run specialized scans for really massive goiters.
Section 5. Treatment and post-surgery care, the resolution. Once the detective work is wrapped up, the medical solutions are actually pretty vast. The right choice depends heavily on the underlying cause, the physical size of the gland, how bad the symptoms are, and the patient's hormone levels. Honestly, a lot of the time, the best treatment is just observation, just keeping an eye on small asymptomatic goiters. Sometimes it's just about tweaking nutrition to make sure you're getting enough, but not too much iodine. If we need to bring in medications, doctors might prescribe levothyroxine if hormones are low, or antithyroid drugs like methimazole if they're too high. For an overactive thyroid, radioactive iodine therapy can actually shrink the gland. And of course, if the goiter is so large it's compressing the airway, or if cancer is suspected, they'll perform a surgical thyroidectomy to remove it. But if a patient does need surgery, the journey doesn't actually end in the operating room. Physiotherapy plays a massive, targeted role in recovery. These therapeutic goals are all about getting you back to living safely. Physical therapists step in to improve neck mobility and cut down on stiffness. They help fix postural issues and breathing mechanics. Through gentle range of motion exercises and scapular strengthening, they help patients drastically reduce pain and get right back to their normal daily activities.
Section 6. Comparing goiters, nodules, and cancer, clearing the confusion.
We have covered a tremendous amount of ground today. And I know when someone hears they have a lump in their neck, their brain almost always jumps straight to the worst-case scenario. So let's lay out the objective facts and clear this up. A goiter is a general, abnormal enlargement of the entire gland, and it is mostly benign. Thyroid nodules, on the other hand, are individual, distinct lumps inside the gland. These are also usually benign, though they do require a biopsy if they look a bit suspicious. Thyroid cancer is a very specific malignant cell growth. The huge takeaway I want you to remember is this: structural enlargement does not automatically equal malignancy. Let's summarize the core medical reality straight from the source. While it can absolutely be stressful to deal with a thyroid issue, most goiters are totally benign. They are highly manageable. Getting an early diagnosis is the ultimate key to preventing complications. It ensures that you and your doctor can figure out the exact right path forward, whether that's just keeping an eye on it, taking medication, or having surgery to keep your thyroid healthy. And that brings us to the end of today's explainer. Your body's master metabolic engine is back there working tirelessly, shaping your energy, your mood, and your entire metabolism. So I'm going to leave you with this final, provocative thought. Your thyroid regulates your entire life. So are you paying attention to what it's telling you? Thanks so much for hanging out and learning with us today. We'll catch you in the next one.